Most AI business cases fail because they rely on soft financial savings. Telling a budget holder you will save 2 minutes per appointment doesn't necessarily matter unless you can prove exactly how those 2 minutes turn into real revenue or cost reduction. Too often these soft savings end up on a slide deck but never translate into real dollars, leaving executives frustrated and AI projects abandoned. Hi, I'm Shuaib, NHS medical physicist and CEO at Newton's Tree. In this video, we'll discuss how to build a rigorous financial case for AI adoption in US health systems. We'll differentiate between theoretical efficiency gains versus realized return on investment, focusing on metrics that actually move the needle for finance teams: increased reimbursement volume and efficiency, stronger net patient revenue, and liability protection. Revenue integrity and patient throughput is where most AI cases fall short. Saving time per scan sounds good on paper, but in a fee-for-service model, time only matters if it increases patient volume. The real metric is patient throughput, how AI allows more scans with the same staff. AI can also strengthen reimbursement pathways. By improving documentation quality upstream, it reduces insurance claim denials, which are a significant hidden cost in US health systems. Optimizing CPT coding and claim processes turns theoretical efficiency into real dollars. The second critical area is cost avoidance and risk. The US is perhaps the most litigious healthcare market in the world, and missed incidental findings like lung nodules can result in high settlement costs. AI provides measurable risk mitigation, reducing potential liability and protecting the health system's bottom line. Framing AI as a way to reduce financial exposure is often more persuasive to executives than soft efficiency metrics. To summarize, a winning AI business case maps directly to the health system's P&L. It speaks the language of the CFO, increasing DRG margins, maximizing RVUs, reducing insurance denials, and lowering liability exposure. Audit your current AI procurement approach. Remove slides that list physician satisfaction or time saved as the primary ROI. Replace them with hard numbers on capacity management, throughput, and risk adjustment. Think about it this way. You wouldn't invest in any major system without knowing exactly how it affects revenue and risk. Why would you approach AI any differently? The real opportunity is delivering predictable and measurable financial impact. At Newton's Tree, we help health systems select, test, deploy, and monitor AI safely and effectively, so you can focus on driving real financial results and improving patient care. If this video was helpful, please like, share, subscribe, and drop a comment below. Thanks for watching, and we'll see you in the next one.